blacklisted playwright, right? And she said, "I cannot and will not cut my conscience to fit this year's fashion." And the fashion this year is compromise. Compromise on healthcare reform and a lot of other issues that we all know painfully about in Washington, and locally, of course. But the question is, compromise is fine. We all compromise every day in our lives. The question is, can we compromise our principles? And I'm afraid that accepting the public option and everything that goes with it compromises too many of our principles that should not be violated. Single payer is a little bit like pregnancy. It's all or nothing. Either you're pregnant or you're not. We can't have a partial single payer system because by definition there's only one payer. And to cut the administrative waste in our system, we must get from 1,500 insurance companies to one. We must get profit out of healthcare. These are fundamental. The term single payer is a horrible term, but really it's a code word for not just a single government insurance, social insurance system, but also for a system that's run in the interest of the patients, of the public. It's saying healthcare is a human right, that healthcare should be funded and controlled like the fire department is as a public good, like the school system is, like the police department, right? People say the police department doesn't bill per felony arrest, right? They get a budget, and that's the way our healthcare system should be run. I know many of you know about single payer. I won't go into great detail, but it's a socialized insurance system where the delivery of healthcare remains in private hands. And when my colleagues started presenting this as an option for the United States about 25 years ago, they thought, this is the last compromise we can make. Many of us felt that a socialized healthcare system would have been a better approach. And people said, socialized healthcare is never going to be accepted in the United States. We'll compromise and we'll have a socialized insurance system. Well, sadly, 25 years later, we're no closer to socialized insurance. So maybe we should have stuck with socialized medicine altogether. But for better or worse, we advocate public administration, public funding. Now, how do we fund a single-payer system? With progressive taxation. And that, to me, is one of the fundamental principles that we can't violate. Healthcare in this country is funded regressively. The poor pay a higher percent of their income for healthcare than the wealthy. It's the exact reverse of what a healthy healthcare system should be funded by. So fundamental to the change is we must have progressive taxation pay for healthcare. And this is so simple, it's elegant. The government takes our taxes and they pay all the medical bills. It completely cuts out this unbelievable, complicated bureaucracy, which unfortunately the centrist Democrats and President Obama are tied to. They want to keep 1,500 insurance companies. They want to keep this incredibly complex system, and it has to go. Single payer eliminates any financial barrier to care. That means copays and deductibles. And a $20, $30 copay for an upper middle class person is pocket change. For the patients I see every day, $10 keeps them out of the clinic, out of my office. It would, if we charged a copay of $10, I would have all day to read the newspaper and do email, because the people who show up in my clinics could not afford even a $10 copay. And the plans that are being put forward in the public option, right? I mean, without the kind of health care that's being put forward is huge copays and deductibles. In Massachusetts, this was an article in Salon online a couple of days ago. All you need to do is go online and look at the Massachusetts Health Plan, which is the model for the Obama and Democratic plan now, right? A family of four, a low-income family of four, pays $9,600 premium per year. Then they have a $3,600 deductible. Is that a lot of money? You know, my wife and I are on the state health plan, and we have a $100 deductible, and it just went up to $300, so it tripled, and we're annoyed about it. But people in Massachusetts, low-income working people, are being forced, because it's a mandate, right? You have to buy health insurance there. The cheapest plan has a $3,600 deductible, 10 times my deductible. So you reach your deductible, and then you have 20% co-insurance. You have to pay 20% of all your additional, or most of the additional medical bills. I think there's some things that are exempted. But is that access to care? That's coverage, but not access. This is not acceptable. This is unfair. And frankly, I think that family would probably, a typical family would be better off without that insurance, because that's really just catastrophic health insurance, right? And you know, it's unhealthy for a family, a young family, to have to pay $12,000, $13,000 out of pocket. You know, they need that money for food and shelter, right? So this is not acceptable. Single payer provides real choice of provider. And this has been played around in the media, right? The president says, no, the American people want choice. You know, I sometimes say to an audience, how many of you want to choose your insurance company? I'll ask them, how many of you want to think that's the most important choice? How many of you want to choose your doctor, provider, or hospital? And that's obviously what real choice is. Only single payer will provide real choice. The employer plans, the cheap plans that are going to be available through this insurance, what do they call it? Insurance exchange, right? Are going to limit people's choice of who they can go to and where they can go. Most employer-based plans in the United States today, how many choices do employees get? One. It's one. They have no choice. They get one, take it or leave it. So if that's what they call choice, that's playing with words. Okay? Choice means choice of provider. That is an absolute necessity.
Excuse me.
Go ahead.
It's possible to hear you, but it takes a lot of work for some of this.
Okay.
Could you possibly use the microphone?
You do better. Okay. I'll give it a try. I'll give it a try. Okay.
Much better.
Thank you for pointing that out. Finally, the public option won't work because it won't save money. Now, this is one more insurance plan out of 1,500. So now we have 1,501 insurance plans. So where is the savings? It's true that that public option will have lower administrative costs than the private plans. But that's not where the money in our healthcare system is being wasted. That's a tiny percent of it. And of course, we have this example with Medicare. Medicare only has 3% overhead, and most private insurers have 20% overhead. Well, that's a savings, but that's not the $400 billion pot of gold that we can save on through a single payer. So where's the real administrative waste in the system? It's hospital billing and physician office billing. And neither of those will be at all cheaper than under the current system. There's actually $200 billion spent a year on hospital billing in excess of what the Canadians spend. This is based on per capita, okay? It's $200 billion. It's a huge amount of money because every doctor's office and every hospital has to bill for every aspirin and every procedure, and this is where the waste is going. So without being able to save money, the public option is not going to do that. So now they have to look at taxing health insurance. That's a non-starter. I can tell you that right now. It's not going to happen. People are not going to put up with that.